A very good afternoon to everyone. This is Fahad Shahid here with you from Prime Health. We welcome you to our webinar, which is under the campaign of Summer Health with Prime. And today's topic related to the kids, children, the babies. A very important topic. We have given an opportunity to you that you may ask the pediatricians, the specialists, the experts that we have at our Prime Health. This is going to be a time where you can, ask whatever you want to our experts. We are live from our YouTube channel, Twitter, LinkedIn, Facebook. So you can see us on multiple channels, whichever is available to you at the moment. So before moving ahead, as we know that summer holidays are coming to an end, schools will be open probably in the next week. And when the schools are open, a lot of situations are being faced by the parents. Sometimes the children get ill because of the traveling or some XYZ reasons. You talk about vaccines, it's the time coming up. So a lot of other things are there that parents need to look into. And for that reason, we are here. So if you have any questions, please put in your question in the comment box from whichever channel you're watching us, and our pediatricians will definitely give the answer to you. Let me just introduce you to our experts of the day today who are with me. I've got here with me Dr. Kedar, who is a specialist pediatrician and a newborn specialist. He is a part of Prime for more than 10 years. Overall, he's been in the field for more than 20 years, practicing in India itself also. Dr. Kedar, thank you very much for joining us.
Thank you, Paul.
And apart from Dr. Kedar, we've got Dr. Tanmay with us, who is a specialist pediatrician. Dr. Tanmay is Asian Indian origin in pediatric clinical practice since 1988. He has treated children of several generations, various nationalities in India and the United Arab Emirates, and contributed to several publications on child care, including the textbooks of pediatrics by the Indian Academy of Pediatrics. So Dr. Tanmay, thank you very much for joining us today.
Thank you, Fahad.
Right. So we are going to start with a few of the questions that are more common here today to both our doctors. And once the questions will be coming in from your end, from the audience who are watching us at the moment, we will be taking those questions live with our doctors. Dr. Kedar, I would like to start probably from you here. Doctor, we know that the holidays are ending up, and the situation is like most of the time it happens that the children get ill or the parents are worried before sending to the school. So what are the suggestions and tips while traveling, especially for those who are coming back from the holidays?
Sure. Thanks, Fahad. Welcome all of you. Thank you so much, all parents, to joining in for this session. I hope this is going to be some valuable tips provided by me as well as Dr. Tanmay. For most important thing while traveling back from your home country, just ensure that you travel safe. All illnesses are taken care of in your home country or after you come back here. Most importantly is the food, what they eat. Please try to avoid food at the airports or overeating or binging by children, because that's another cause because of which children come to us immediately after they come back from their travel. Another important thing is about vaccinations after they come back from their vacations. Flu vaccine is equally important, as well as COVID vaccine. Now, government has already started the COVID vaccine for children above 5 years of age. And please ensure that your child gets this vaccine if he's above 5 years of age. Another important thing is that once the school starts, there will be a lot of infections in the air because people will be traveling from different parts of the world, and the children will be getting all these infections into the classroom. So ensure that your child gets a daily dose of vitamin C and stays away from most of the infections by wearing a mask and following all the precautions which have been listed by the school authorities. Another important thing is for parents to realize that Please do not ignore even smallest of the smallest complaints which a child presents with to you, and get him to the doctor and get him treated fast, so that he doesn't spread the infections in the class to his classmates. Another important thing is that please don't try self medications, because these are a commonly things done by the parents at home just to avoid the clinic visits, and it definitely bears on to the child facing major infections or some other side infections which can be easily go unnoticed by the parents. Also, to see to it that after the vaccinations are done, you see to it that your child is given some time to recover from it. Don't come out for the vaccinations when you are immediately, when you have just landed up from your vacation and the schools are about to start. Give at least a week or 2 weeks time for the vaccine to start showing its effect, so that your child can be well protected in the class. And another important thing is about eating food on time. Equally important, please see to it that your child eats healthy food and on time. That's very important. Thank you, Fahad.
Great, great. Thank you very much, Dr. Kedar, for this initial information that really needs to be taken care of. I'm sure we're going to go deep into this more. Dr. Tanmay, uh, yeah, Doctor, talking about the infections that occur. Now, we've got infections which are occurring in children in summer, and then we've got infections which are occurring in children in winter. What is the difference in how we can take care of that part?
Yes. Okay. Thank you, Fahad. And thank you, Dr. Kedar, for being with me on this. And welcome to all of you and good afternoon. Uh, there is an inherent difference between the infections that occur in summer vis-a-vis those that occur in winter. As you know, the two major groups of pathogens or pathogenic germs that infect children are basically viruses and bacteria. And viruses in general are more susceptible to the effect of heat and drying, and therefore they are more common in the winter seasons. Whereas bacteria tend to be in general more resistant to heat, and they can survive in both dry as well as humid climates. And so we see a sudden surge in the bacterial infections during the summer months. This part of the year is a little tricky because we are almost to the end of summer. Maybe the summer will last for another 1 or 2 months, and then the winter season will begin. So we will soon be approaching the transition phase. And that is a tricky period because you tend to get a mix of both. Of course, there are numerous exceptions on both the sides, both the viruses as well as the bacteria. The kind of infections that we are seeing currently right now are a lot of bacterial throat infections, ear infections, even bronchitis cases, and also skin infections we see. So these are some of the common infections that we are dealing with right now in our clinical practice. But as Dr. Kedar very rightly said, that we have, as you know, in Dubai, we have more than 200 nationalities, and a lot of expatriates would be returning back from their home countries or from the holiday places, destinations that they have visited. So they would be bringing a host of different kinds of germs um, into the country when they return. So we have to all be prepared for this. The parents have to be prepared for this, as well as we as doctors have to be prepared for this. From the parent side, as Dr. Kedar very rightly said, the important things is, I think one of the most important things in prevention of infection, which has created a kind of milestone in the history of prevention of infections, is hand washing. So maintaining hand hygiene and maintaining what we call cough etiquette, that means using a mask and protecting one's nose and throat from infections. These are the important things to prevent infections that occur, especially in summer.
Thank you very much, Doctor. Dr. Kedar, as Doctor rightly said, that there'll be kids coming in with a lot of germs who are traveling all the way here. When you talk about food, should we consider eating of food when coming back, or what kind of food a person should eat while during the summer or in the transition process?
Yeah. See, as I mentioned earlier, most of us tend to eat a lot of cold beverages or ice creams for that matter before traveling. what I normally advise my patients to do is that to stay away from all these things at least 2 days before travel, and even after a week after you come back from the vacations, because that's the time when you should allow the children to get acclimatized to the weather out here once they have come back from their home country. Their home country, the weather might be different. It might be winter or it might be a rainy season out there. And there are certain infections which can trigger up after they come back here if they have had ice creams or, for that matter, some juices, cold juices which have hit the throat already when they were in the home country. Another important thing is about lactose intolerance. We have seen a lot of kids landing up with diarrhea after coming back here. So always I tell my parents, my patients, to stay away from dairy products when they are coming back into the country, so that they can avoid missing school after they come back to the country. Another important thing is about having too much of oily or spicy foods, especially junk foods, which can lead to gastritis in children. No matter they can easily digest the foods, but still we have seen a lot of children with stomach issues, especially after coming back from their vacations. So in general, try to eat healthy food, homemade food, and on time. That's very important.
Thank you very much, doctor. That was really something. I got a new information that we need to take care of first. Like the children should avoid dairy products, especially. Absolutely, point well taken. So, Doctor Tanmay, coming back to you again here, doctor, is this the right time? Is this the absolutely right time to vaccinate children against influenza?
Yes, of course it is. The flu vaccine has just come into it's just being available in all the medical centers and the hospitals now. And this is absolutely the right time. And I think Dr. Kedar already mentioned that most of the vaccines take at least around 15 days to show their effect. So this is the absolute appropriate time because the schools are just maybe a week away now. So at least within 1 week of rejoining school, the children would be immune to influenza. So this is the absolute right time to give the flu vaccine. Just to note about the flu vaccine is that many parents ask us which flu vaccine should they give, the summer flu vaccine or the winter flu vaccine, and so on and so forth.
Right.
See, the thing is that influenza has a different peak season depending upon the geographical region that you're talking about. In the southern hemisphere, for example, in Australia, the peak season of influenza is in their winter, and their winter corresponds to our summer. So they are having the peak of winter right now, and that's their season of influenza. In Dubai and in most of the GCC countries, we see a peak of influenza occurring somewhere between the months of October to around maybe February or so. And but the whole period stretches somewhere between, let's say, end of September and goes on to almost, I would say, out of March or April, with some sporadic cases occurring even in May, June, and July. But the peak season is during the winter. This is one thing. And the second thing is that those countries which have a specific monsoon season, for example, India, Pakistan, Bangladesh, Sri Lanka, Thailand, and Malaysia, and these kind of places which have a proper monsoon season which corresponds to the summer here, they have their peak of influenza during the monsoon months. So they prefer to use the summer flu vaccine because that's the peak season when they have the influenza. So the vaccine that we procure here and which we administer to the children here is the winter influenza vaccine, which is used for the northern hemisphere. So parents should be clear as to what vaccine they are taking when they're giving or they're giving flu vaccine to their children.
Right, doctor. Just to add on this question, I wanted to understand: does the flu vaccine protect children against recurring throat and chest infections also?
Well, this is a common misapprehension, sorry, misunderstanding in parents. Well, it's like this. The word flu is very loosely used to describe a cold in a child. They say flu ho gaya hai. But actually, flu is the short form of influenza, and influenza is a very specific disease caused by the influenza virus. So every cough and cold and fever doesn't necessarily mean influenza. So the influenza vaccine is going to protect specifically only against influenza A and influenza B virus. And although the vaccine contains about say 4 or 5 variants of viruses, virus antigens, but the same virus strain repeats once in 5 years or so. So that strain is always added, and some of the other more common strains or the more important strains are added every year in the vaccine. So the child will be protected against influenza specifically, and definitely not against every cough, cold, fever.
Right. Thank you, Dr. Tanvi. Now, talking about the vaccination, we understand how Dr. Tanvi has explained. We've also got the information from Dr. Kedar. Now, moving forward, Dr. Kedar, I would like to ask you. Vaccine is one part, but apart from vaccines, how what are the common problems faced by the children in summers, and how we can really avoid them?
Sifa, since the temperatures out here in Dubai at this moment are on the higher side, as Dr. Talmay rightly said, we see a lot of bacterial infections in the air as compared to viral infections. But of course, given we also have to take in the benefit of doubt that there are so many people who are traveling, Dubai is like a tourist destination for many people, and they get even the viruses along with them to the country. So the first and the foremost thing is hand hygiene, wearing a mask, and third important thing is carrying a hand sanitizer with you so that you minimize the risk of contracting the infection. Given another thing is that when you are also trying to eat the foods, food also adds to certain infections in the stomach, which need to be taken care of. So eating a proper clean food is also very important. Do not resort to stale food which you have kept in the fridge overnight, and avoid giving this to children because they are the ones who can easily suffer from infections by eating this stale food as compared to you as an adult. So my request to parents is just try to see to it that give them fresh homemade food and keep them away from infections. That's the best way to stay infection free.
Right, and Doctor, thank you. I want to understand one more thing. I'll just ask you a question, probably which will be similar to this. What COVID safety measures would be applicable for children? Definitely, they're going back to the school.
Yeah. See, one should not forget about COVID because COVID is still there and we will definitely expect it to boom around winter again. So we need to follow the universal precautions which have been listed by WHO as well as the CDC guidelines, where hand hygiene, wearing a mask, and staying away from crowded places always is going to be there for the next couple of years. Apart from that, vaccinating a child. Now, DHA has already issued the circular that any child above 5 years of age can be vaccinated. So my humble request to all the parents is to please don't ignore this circular given by DHA, and please get your child who's above 5 years of age to get vaccinated. Don't deny him the vaccine because COVID vaccine is equally important for him as it was important to you. Another important thing is that there are so many myths about COVID vaccine. I've been hearing from parents. I was surprised to hear all these things. Please do not believe in any myths or any rumors. These are all for the vaccines are being safely entrusted to be given to your children, and please let them have this vaccine because no matter what happens, the vaccine is going to protect your child from getting these infections, or at the same time, even if a child gets the infection, it's going to reduce the severity of the infection. So please go ahead and get your child vaccinated because it's equally important for him to stay away from infections and to protect his schoolmates also from getting these infections.
Doctor, thank you so very much. Coming to Dr. Tanvi. Dr. Tanvi, schools are reopening and everyone will be going back to school. We'll see a lot of children, as earlier Dr. Kedar said. In fact, you also said that there'll be a lot of germs and bacteria coming in from different countries. Before school reopens, what is the routine health examination the kids should go for, or should they go for it or no?
I would strongly recommend that every single child undergoes a routine health examination before he or she joins school. See, there are a lot of health issues in children which can go undetected before they reach a little late or a more advanced stage. I remember way back in my school days, you know, it was a part of the school routine itself to have at least an annual examination, medical examination of all the school students, right from grade 1 to grade 10. So we used to undergo a medical examination to check that our hearts and lungs are functioning properly, to see that we don't have any skin diseases, also a dental checkup and an ophthalmological examination. That means an eye examination to see if we require glasses. These are some of the basic screening things that were done for all school children back in those days. I don't know how much of it is being done in all the schools now, but even if the schools are not recommending it or not doing it as a part of their routine, I would suggest that the parents should be more proactive in this and should have at least a routine dental examination and eye examination done for their children. Besides, of course, a general examination if the child has any pre-existing conditions, like say, for example, asthma or eczema or any such condition. As regarding eye examination, I would recommend that they do it at least once a year, if not once in every 6 months. The correct age for dental examination would be one examination at the age of 3 years when they cut all their 20 deciduous teeth or their temporary teeth, and one examination at the age of around 7 years when these temporary teeth start falling and the permanent teeth start to erupt. And then one examination somewhere around maybe 10 to 12 years of age when they have completed getting all, not all, but at least 28 out of the 32 of their permanent teeth. The reason for this is because one thing we can look for caries or any other dental infections, and they can also see if the child has any overbite or a crossbite, which requires any orthodontic treatment or any other such things. And if these things are treated in time, then the treatment is shorter and it's much more simple. Whereas if these things are neglected at this stage, then the treatment becomes more prolonged and little more difficult. So these things should be routinely done by the parents before the children join school so that most of these things can be completed before they actually start attending school.
Great, thank you so very much, Dr. Tanmay. I've got a question here for you. I'll just show it to you. That's on your screen. It says 3 years old, suffering from stroke. If
Crow.
pardon me, yeah, crow. Yeah,
Yeah,
what is
crow.
this and how to cure it, doctor?
Yeah. Cru is a kind of a condition which is a viral infection of the voice box, that is the larynx. And it's because of swelling of the vocal cords because of viral infection. And typically, children present with a barking kind of cough and what we call a stridor, that is a noisy kind of breathing that is accompanying this condition. And the treatment for it is basically we give nebulization with a mild steroid. Sometimes even injectable steroids or oral steroids may be required in some of the severe cases. And as long as the child is able to breathe well and is eating well, and the parents are able to maintain the hydration and the nutrition of the child, this condition is manageable at home. It's only in severe cases where the child is breathless or has difficulty in eating or is not able to maintain his hydration. Those children, of course, need to be hospitalized and given nebulization, either with racemic epinephrine and or with steroids, and managed until they can breathe easy and go back home. I hope this answers the query.
Right. Definitely. Thank you so very much, Dr. Tanmay, for the detailed answer. I hope this answered the query. Dr. Kizar, I've got another question here, and I would want you to answer this. The question is from Dr. Nadia, and she says, "Boy is underweight and short. Tests are normal. What do you suggest for this?"
It's a
Hello,
million
Dr.
dollar
Nadia.
question.
This is a very common question which we commonly encounter in the clinic. See, generally, what I tell most of my parents out here who come to me with this similar complaints is that between 1 to 5 years, don't expect your child to gain weight. This is the time when he's going to gain a lot of height. Ensure that he eats healthy food and see to is that he stays away from infection. Doesn't mean that if your child is not gaining weight or height adequately, that he's unhealthy or he has some issues. There can be a lot of children who can stay healthy. I have seen so many children who are lean and tall, but they have the best blood reports in the town, and we do not have to do any supplementation at all. Just ensure that they eat well. After 7 to 8 years, see them gaining their weight back to the normal, the stature wise, as compared to their height and weight for their age required. So my request to Dr. Nadia is that just don't worry if all the tests what have been done from your side have been normal till now. Just ensure that your child eats healthy food on time, gets adequate sleep of at least 8 hours every day, and stays away from infections. That's it. And believe me, you are not going to be even visiting a doctor to get any tests later on.
Dr. Kedar, if you will allow me to just comment a little bit on this.
Please, Doctor Tanvi, you can add on. Thank you.
Yeah. Yeah. See, what Dr. Kedar said is absolutely true, and I 200% agree with him. Just I would like to add a couple of points. One is that in my experience, whenever I have, had some detailed discussions with most of the parents in Dubai, what I find is that most of the children here don't actually fall short of proteins, but they seem to fall short of calories. When I look at their the daily intake and I try to calculate item by item all the calories and the proteins, I find that most of them are getting their protein. They're getting at least maybe 1.5 to 2 grams of protein per kilogram body weight per day, but they're not getting. Sometimes they don't even get 1,000 calories in a day. So that is one thing. Second thing is there is a lot of confusion in parents regarding food groups. For example, let's say in my case, if I am hungry, I cannot substitute a lunch with a cup of tea because it will not provide the same calories and proteins. And this is where some of the parents get confused. For example, they may substitute, let's say, a sandwich with a fruit, but they are not from the same food groups because they're not providing the same calories and proteins. So parents need to understand which are the food groups. For example, cereals is one group, and legumes, pulses is another group, and sprouts is another group. Dairy products is another group. Fruits and vegetables is one group. Your eggs, fish, and meat is another group. So you can make the substitute in the same group, but you should not substitute from one across to the other group because that will not provide the same calories and proteins. This is one thing. Second thing is that uh, uh, if the child is underweight, that means less than the 50th percentile for his age, there are two ways of looking at it. That is weight for age and weight for height. So, as Dr. Kedar rightly said, as long as the child is proportionate and within the 50th percentile, there should not be any worry. The red flag signs would be if the child has fallen off the chart. That means the child has been growing well in his own percentile, and suddenly he or she falls off the chart. Then that may be the sign of some some underlying condition which the parents have not yet addressed. And the second thing is that uh, uh, like weight loss or lack of weight gain is more a sign of short-term malnutrition. Whereas if the child is actually not growing in height for a long period of time, that may indicate um, a long-term malnutrition. That could be one of the causes. And the last comment that I would like to make is that we have, as I mentioned earlier, also we have more than 200 nationalities. And Dubai is one place where you see all kinds of shapes and sizes of human beings. So, depending upon what nationality you are, the the sizes of the parents themselves is different. The heights and their weights and their statures and their body build is completely different from nationality to nationality. And obviously, the children are not going to look uniform. So, all these things have to be borne in mind when one is analyzing any child's weight or height. That's just what I wanted to add.
Definitely, that's added a lot of value apart from Dr. Kedar's answer. Also, so thank you to both the doctors on answering this question. Dr. Tanmay, I would like to ask you this question again here, Doctor. What is the fallout of inadequate hydration in children, especially in summer?
Fallout of inadequate hydration. You mean
Yeah.
dehydration? Yeah. See, the thing is that Dubai, the heat of Dubai or the heat in the GCC countries basically is a very dehydrating heat because it's very dry. We are in a desert area. So, and humidity, even though there is some amount of humidity in the months of September and all, it is not enough to, keep our skin and our bodies hydrated. That is one thing. And so the susceptibility or the vulnerability to dehydration exists in all of us, whether we are children or whether we are adults. On the top of it, what I have seen, and probably even Dr. Kedar will agree with me, is that most parents tell us that their children don't drink enough water. And the reasons for this are multiple. One is that during the COVID years, children had to have a very strict social distancing, and they were not allowed to use the washrooms except for certain times during the school hours. And this had made it very difficult for them if they feel the sensation to pass urine because they have taken a lot of intake. And somewhere at a subconscious or a conscious level, these children then start avoiding drinking water so that they can avoid having to use the washroom during the school hours. This is a very tragic thing which should never happen, but this is what is actually happening in reality with many of the school children here. And this has resulted in multiple health issues. I'm not talking about actual dehydration on in an obvious child, obvious signs of dehydration in a child, but I'm talking about subtle dehydration that goes on for a long period of time, which results in constipation, results in gastroesophageal reflux, results in a high colored concentrated urine with burning sensation when passing urine. These are common complaints that as we all pediatricians see here, and that is because of long-standing low-grade dehydration that is going on in these children. And of course, very children here tend to be very sportive, so they do indulge in extracurricular activities like swimming, basketball, football. All these will suddenly increase the body's demand for water. So the children don't remain hydrated before, during, and after any kind of vigorous sports activity. Then it makes them more vulnerable to dehydration. So all these things parents should keep in mind, and they have to inculcate this habit in their children of drinking adequate amount of water. How would you know? A simple way a parent would know that the child is well hydrated is if the child is passing one clear, colorless urine at least once in every 3 hours. That means you know the child is well hydrated.
Right. Thank you. Thank you so very much, Dr. Tanmay. Wonderfully explained the whole information. Dr. Kedar, I've got a question here, which I want you to answer on this one. The question says from Mr. Muhammad Ashik, which food is suitable for school-going children? I know you've answered this, but a little elaboration would be on a specific thing would be good.
Hello, Mr. Mohammed. See, it depends upon the age of the child. I have seen a lot of parents giving flavored milks in their tiffin boxes to their children, which I strongly recommend not to be given. I have seen a lot of kids taking packet juices and all these frozen stuffs with them, and I would definitely not encourage parents to do this. Try to give them a healthy breakfast. Encourage them to eat them along with you so that they get into the habit of carrying this with them to school. If you don't encourage or teach your children to eat healthy foods, they are definitely not going to learn about it. So a simple thing to do is that see to it that the morning starts with a glass of milk before going to school with maybe some 2 or 3 biscuits, digestive biscuits, or a slice of bread butter or bread jam, which should be enough to keep his sugar levels and brain active for the first part of the day. And then in the breakfast, it should be something which should be high in proteins and more of something which can give him energy to sustain at school in a very healthy and a productive way. So see to it that you don't give him too much of junk food, which will try to get him deviated from his work at school, or his activities at school will be hampered because of that. And encourage drinking a lot of water even at school. I know most of the kids don't do enough of water intake through in the school time, but say you have to encourage those habits for them so that they can continue that doing it school also. Another important thing is that see to it that you avoid giving any stale food also to them, which they will be eating the next day at school, and see to it that the food is adequately packed so that the quantity is also good enough for them to enjoy it. That's my answer to Mr. Mohammed Ashik.
Thank you. Thank you so very much. Thank you. Thank you so much, Dr. Kedar. Dr. Kedar, I have another question related to the physical and mental, activeness. How to keep children physically and mentally active during vacations?
Yeah. See, what happens is that generally during vacations, at least in Dubai, where we see most of our parents, both the parents are working, that the child is either left with a maid or it's left at the babysitting, or maybe a simple nursery where they go and they enjoy with the other children, as compared to what childhood we enjoyed. There was the vacation time was a lot of physical activity which is not seen out here. So what I would suggest to the parents how to do out is that at least once you come back from work, encourage your child to build up some hobbies related to sports where they can spend a lot of time and energy. These kids have a lot of energy, but they don't know how to utilize it. So try and inculcate some habit, or maybe try to channelize the energy what your child has, and indulge it. Let him indulge in some sports activities like swimming, tennis, badminton, wherever your child wants to go. But do keep them away, because do keep them in some activities during the vacation or even during the school times, because that keeps the body active as well as the mind fresh. So that's another thing. As compared to a child who's say maybe 1 or 2 years old, where you can't encourage these activities, I have a few patients who have been encouraging their children and taking them for swimming sessions from the age of 9 months of age. And I really appreciate the parents who have been doing it, because no matter, there will be some side effects like maybe having some ear infections or some chest infections which the child might suffer. But encouraging these habits at such a tender age has definitely is going to be working wonders for the child later on in life. So my request to all the parents is that indulge them
Right.
in activities and keep them active and busy, apart from the YouTube and the comedy shows which go on on the televisions. Encourage them to have some physical activities so that they can be fresh and active, and even be eating well and gaining their weight and height as per the charts.
Right. Thank you so much, Dr. Kedar. Dr. Tanvi, a question which is related to something what Dr. Kedar has already answered. We just spoke about the mental and physical activity of the children. Now we are living in an era where tablets and mobile phones and all the day you see Tom and Jerry and Diana and all of those characters on the television that the kids are watching all the time. So I've got a question here which is probably similar to that, and I want you to just elaborate it, and you can look into this question. Dr. Krishna says, Doctor, my kid wants to play video games. His age is 8 years old. Please suggest. Now, you talk about video games, they're still on the screens. You talk about the kids' shows and all that, it's also on the screen. How do you look into this? Is it beneficial, or it should be having a specific time bound where they should watch it? Or how do you look into this? Because a lot of the parents, what they have done with their kids is that when it's time for their lunch or dinner or breakfast, they put on the TV and they let their child play a video game or look into the TV, and then they give them food. How is that? Doctor, you're on mute. You're on mute, Doctor.
Well,
Great, thank you.
to be to be honest, video games are like a double-edged sword. There are pros as well as cons to video games. So first, let me explain the pros actually. The pros of video games is that many of them provide what we call infotainment. So they do provide some good information. So some of the video games may be actually providing some information, good and useful information to the kids who play them, depending on what game you're talking about, of course. And the second thing is that some of these games may also improve skills, some specific skills. For example, some of the video games involve driving or riding a bicycle virtually when you're playing the game, or avoiding certain targets, or those kind of things. So to some extent, it will help their emotional and mental skills. Uh, so that is one thing. And also, of course, naturally, it provides entertainment and some relaxation, which is distraction away from their school and their routine and their academics and so on. So these are some of the benefits that video games will provide. So the harm that it will provide, it can do is, number one, it can cause an addiction. So there are many children who are addicted, and many adults, in fact, who are addicted to video games. So that danger is inherent in this pastime itself. And the second thing is that some of these games encourage a lot of violence and involve killing and torture and these kind of things. They also involve some of very dark characters in the video games themselves. And this may have a negative impact on the children who play these kind of games. So parents have to be very, very careful in the video games that they choose for their children to play, which they may not always have the say in, because the parents, the children, especially the preteens and the teens, will insist on specific games that their peers, that means their other classmates in the school, have recommended, or what seems to be popular in their age group at that particular point of time. The second thing is that video games will, of course, cause eye strain. It will also cause strain on the hands and the wrists and the fingers. So this can result in the child developing the need for glasses and a rapid increase in the number of their eyes, and also can cause uh, steal or rob the child of the time that is required for the child to indulge in physical activities which keeps them healthy. So I remember very long back, the American Academy of Pediatrics had published some data on American children and their use of electronic instruments. But that time, things were not so advanced. So they had at that time recommended that a total screen time of maybe around 2 hours a day might be considered all right. But this includes everything, and when I'm talking about screen time, it includes the time that they use on the iPad for their academic work, as well as whatever they may be doing on their laptops and mobiles and their iPads. And then, of course, it includes video games also. So if you put it all together, what I would say is that it's fine. You don't have, there's no hard and fast rule to say yes or no for video games. As long as this is controlled, the time is controlled, and the kind of video games that they're playing are suitable for their age.
Thank you, Doctor. Doctor Kizar, would you like to add on something in the same
Also
related
like to
to
add,
video games or anything? Yeah, please, please.
what Dr. Tanmay said was exactly the things what I wanted to mention. But I would just like to add something more, is that just ensure that when he's playing these video games, there is adequate lighting in the house. See to it that he's not straining his eyes and he is not getting addicted to it for a long, long time. As Dr. Tanmay rightly mentioned, that American Academy of Pediatrics has mentioned 2 hours. Even the CDC guidelines mention that not more than 1 to 2 hours for children above 10 years of age, and only for half an hour to 1 hour for children below 10 years of age. So, if Dr. Krishna, you can just allow your child to play for less than a half an hour to 1 hour, definitely, but see to it that there is some parental control over what exactly the games he is playing, and it's not impacting his regular active curricular activities at home as well as at school. That's very important.
Great, thank you, Doctor. I would like to ask you the very next question that I've got here from Shipla. How to change kids' habit of not eating fruits because become nauseous while having the smell of every fruit, even not ready to taste once.
See, this is another common complaint which most of the mothers come to us in the clinic. My only suggestion to Ms. Shirin is that just ensure that whenever you all are eating fruits or when you are giving fruits to him, ensure that both the parents or the siblings are also eating the same fruits. And it's a very common habit for most of the children to smell something before they eat it, so that because their mindset is that, okay, only if my brain likes the taste of this fruit or this food, only then I'm going to enjoy it. So ensure that his mind is diverted, and see to it that all of you enjoy the same fruit, eating the same portions together at the same time, which can encourage him to eat. And it's not just one fruit at a time. You can encourage all your children to have 2 or 3 fruits at a time, so that they don't get to know what exactly was the taste of one fruit which they would have not disliked it or something. So ensure that see to they ensure that they sit together and enjoy with the entire family, and believe me, maybe in a very short time you will see them enjoying the same fruits.
Great, thank you so much, Dr. Kedar. Thanks a lot for the answer, Dr. Tanmi. I have another question here. I would want you to answer this. This is Dr. Asha who's asking the question. My child is having frequent cold without any other symptoms. What the child should take, what she should take care about? Please suggest.
All right. Well, the age and the gender is not mentioned, but anyway, it's fine. I can still answer the question. See, any what is a cold basically? The symptoms of a cold include basically a runny nose, with or without a blocked nose, and sometimes noisy breathing, sometimes mouth breathing, sometimes uh, excessive episodes of sneezing, and sometimes may be associated with facial pain, with or without headaches, may be associated with a cough, may or may not be associated with fever. So there are so many other variables that one has to keep in mind. But in general, a cold which doesn't go away uh, with simple medications within maybe 5 to 7 days time is something that needs to be reckoned. So, the commonest causes of a persistent cold or a recurrent cold would be, one is adenoidal hypertrophy or adenoidal enlargement, and second is allergic rhinitis, and the third thing is that this is more common in children above the age of 7 years, and that is sinusitis.
Just
So,
to mention on Doctor, I'm sorry, I'm cutting you here. She has mentioned in the comments that the child is 3 years old and only running nose.
all right. So the sinuses, except for the maxillary sinus, none of the other sinuses are open until 7 years of age. So that is ruled out. But adenoids is a very common cause, and allergic rhinitis is very common. Now, the difference between these two is that in adenoids, you will see adenoidal enlargement. You will see that the child has tends to breathe with the mouth. So there's mouth breathing during the daytime, which gives a very dull kind of expression on the child's face, and the child will have a very noisy, stertorous kind of breathing at night, sometimes with even snoring kind of noises. The child will tend to keep the mouth open even during the night when the child is asleep. So see, these are some of, and because the child is mouth breathing and bypassing the nasal filters that filter the dust and the bacteria and all that, the child will be inhaling the bacteria and the dust and all that directly from the mouth into the throat and down into the lungs. So a child with adenoids may become vulnerable to frequent infections of the throat and frequent infections of the lungs. So this is how we can pick up a child who has adenoidal hypertrophy. A child with allergic rhinitis would not have any fever, but would have recurrent episodes of frequent sneezing, itching of the nose, rubbing of the nose, itching of the eyes, rubbing of the eyes, redness of the eyes. So these are some of the symptoms, and the triggers may be obvious. Like the child may have these symptoms when the child is exposed to, let us say, a pet dog or a pet cat, or some birds, or some other allergens in the air, or when the child visits the garden where there are flowering plants and pollen of flowers and so on and so forth. So, any child who has a frequent or a recurring cold, even if the child does not have any other symptoms, we need to investigate and see what are the other further symptoms and signs. We need to clinically examine the child and then look for possible underlying causes. One more thing I would like to just bring to Dr. Asha's notice is that many of children of this age group sometimes come to us with an undetected foreign body in the nose. The child may have put something in the nose, maybe a small piece of paper or a bead or a piece of thermocol or something in the nose, even as long back as maybe 1 year before this. And it may go undetected, it may remain asymptomatic for some time, and then slowly start developing symptoms of a recurrent cold. So all these things have to be kept in mind when we are looking at a child whose cold is recurring or a cold that's not going away quickly with simple medicines.
I would like to
Great, Doctor. Thank you.
yes,
Thank you for.
Fahad, I would just like to add something more to
Please,
the.
please, please, Doctor Kedar. Please.
One suggestion to Dr. Asha is that I just wanted to know if your child has been recently starting to go to a nursery, because if your child has recently started nursery, it's very common for children to face these infections for the first 6 to 8 months after they join the nursery. Another important thing is that if you feel that the symptoms of cold are quite frequent, and if you have visited a doctor, one suggestion to get it done is iron deficiency, to check for iron deficiency, because that's another thing what we see, iron deficiency anemia, which can present up with recurrent infections. So just keep in mind these two things next time whenever you're visiting a doctor.
Great. Thank you. Thank you so very much, Dr. Kedar. Doctor, I wanted to ask you a question here. Uh, Now, when you talk about summer, we know that in this part of the world, the summer is probably hotter and it's very hot outside. So, talking about the skincare in children, actually, what is the specific factor for sunscreen lotions for children?
Yeah. See, as we know that even in the summer season, we get a lot of tourists and children especially. The sun protection factor, what we call is that the SPF factor, we get a lot of products in the market, in the pharmacies available, in the supermarkets also. But generally, we rely that an SPF of not less than 30 to be used and not more than 50 to be used. It depends upon your child's skin. So my recommendation is that always visit a dermatologist, let them or a pediatrician or your pediatrician, let him assess what is the best SPF lotion for your child and then only use it. But in general, if you're taking the child out for a swimming session or a something just an outdoor activity for a day or so, an SPF factor of 30 should be enough for any sunscreen lotion to be used. Another important thing, what I always tell most of my patients out here is that when you're using the sunscreen lotion, never use it directly on the skin. Always see to that you first moisturize the skin and then use the sunscreen over it. It should never be that you should be directly applying the sunscreen lotion on the skin. So when you use it, generally it gives you a protection for at least 6 to 8 hours. Do not
Right.
fall prey to all these new products in the market. Just try to rely and trust age-old products, and most of them are which are related to the baby products. That's my only suggestion.
Great. Great. Thank you so much, Dr. Kedar. Coming back to Dr. Sanmay. Doctor, looking into the other side of the picture now. Definitely, it's hot outside, and since the AC is used more intensely at home
Yeah.
during the summer, any precautions to take regarding maintaining the quality of internal air?
Yes, yes. See, we do get children with. I think Dr. Kedar will agree with me that respiratory symptoms are the commonest symptoms that any pediatrician sees in clinical practice, and there is a good reason for that, and that is because, to be honest, the quality of internal air in all GCC countries requires much to be desired, and the most common issue here is one of dust. So there, there are many things. And the other thing is that there may be a lot of allergens or there may be a lot of pollutants inside the house in other environments. For example, in the school or the school buses or the play areas or any other areas that the child visits. But those are beyond our control. What is in our control, what is within the control of a parent, is to control the quality of air inside the house where the child spends time for at least a good 12 to 18 hours. And if that can be done, then that helps the child's respiratory system to heal and heal itself and repair itself, even if it faces the onslaughts of any kinds of damage when the child is outside the house. So, what are those things that can be done? One thing is, I would recommend that a deep cleaning of the air conditioning ducts to be done for the entire house at least twice a year. One should be at the beginning of summer, and the other should be at the beginning of winter. And the second thing is that the mattresses that we use, they have a lot of dust mites inside them, and likewise the pillow stuffings. So regular vacuuming of the mattresses on which the children sleep and regular dry cleaning of the pillow stuffings is another thing that is important. Likewise, curtains also. And the third thing is that I would recommend rather, that preferably children should not sleep with soft toys next to them because soft toys are not generally very hygienic. Or if at all they are being used and the child insists on having them next to him or her, then the parents should ensure that they are maintained clean and the kind of fur or the kind of hair that is there on the soft toys is such that is doesn't cause any allergy or harm to the child. Then the third thing is if there are any household pests, then those should be attended to because some of the household pests, especially cockroaches, are known to cause all kinds of respiratory allergies as well as infections in children. Uh, Certain items in the house like carpets, rugs, mats, these can be what we call dust catchers. and it's very difficult to get them clean. Practically speaking, even if you vacuum them every day, even if you send them to the laundry for regular shampooing and so on and so forth, it's honestly speaking very difficult to keep them very clean, and they invariably catch a lot of dust. So these things have to be borne in mind if if a family is very fond of keeping very large carpets or rugs or mats inside the house. Then again, children's exposure to things like cigarette smoke, vaping, very strong air fresheners, bukur, and these kind of incense sticks, these burning of incense sticks, these are things which may harm the child, especially if they're exposed to it for a long period of time. So all these things contribute to the quality of internal air inside the house. So and oh yes, one more thing is that there is unseen dust inside all our houses. Like for example, on the top of the wardrobes or behind some of the furniture which we have inside each room. So these are all the areas that parents need to address, and a thorough spring cleaning from time to time should be done inside the house to maintain a good quality of internal air, which will help their children to remain as free as possible from allergic as well as infective respiratory symptoms from time to time.
Great, doctor. Thank you so very much for the detailed answer. Uh, Coming back to as we are moving towards the closing of the session, so I would just like to ask the last question to Dr. Kedar, and then we will move towards the closing notes from both the doctors. Doctor, we've spoken about kids, we've spoken about school-going kids, we've discussed probably a lot of we've touched probably each of the department. Now coming to the newborn, what are the tips that you would give to the newborn babies and to the parents who are listening to us at the moment?
See, my a simple few tips for most of these new parents who have welcomed their babies in the last couple of months is that see to it that you visit your pediatrician on time. Please do not believe in suggestions and advices given by your friends, family members. And another important thing is that resort to vaccinations on time, and please do not use any homemade solutions for simple problems for your child. I have seen a lot of children, baby mothers coming to us with problems which have been easily avoided by just visiting a doctor. And that's the thing, that just see to it that you stay away from all these advices given by non-medical professionals, and ask your pediatrician to help you out in any concerns with this. Another important thing is that see to it that your baby is the baby you're using only baby certified toiletries for your baby and nothing else. No homemade products required. Do not introduce anything like honey or anything. And breastfeeding should be for encouraged for the first at least 6 months as per the WHO guidelines. If not possible, for as long as possible, they can continue. Exclusive breastfeeding has to be continued. And see to it that you visit your pediatrician for when it's time for your child to be weaned off and to getting his normal foods from the house. Another important thing is that apart from the vaccinations, what you take from the government, there are a long list of optional vaccines which are also to be given, which the government doesn't give. So please consult your pediatrician and see to it that you also get your child vaccinated with these optional vaccines.
Right, thank you, Doctor. Dr. Kedar and Dr. Tanmi, I would want both of you to give your suggestions on them. This is on the mental side of a child that I wanted to ask you a question. A lot of parents discuss and talk about it. So I wanted you to, because we've got experts here with us who would answer this. Now, September is starting, and there'll be new session for the kids who will be going to start the school. What do you suggest? What should be the right age for a child to be admitted in the school? Dr. Kedar, first, if you can just speak about it.
Sure. See, as far as the question arises of sending them to school, as per the DHA guidelines, we are normally following this 3 years schedule. But what I encourage most of these parents who come to visit me is that try to encourage them to put in some babysitting or a simple nursery where a child can enjoy the company of other children, because that is like preparing a child to get into the habit of entering the school without any school phobias or any other issues at that time, because we see that our child, we as a parent, we don't expect our children to face any mental issues during the first 5 or 6 years of life. But believe me that we have seen a lot of issues. What do we term as school phobias are always related to these mental issues, which we don't realize as parents. So I generally advise most or encourage most of my parents to see to it that your child starts nursery maybe at 1.5 to 2, a simple nursery which where there are kids of his age, where he can learn to socialize with them and start preparing himself for entering the school at the age of 3. And then gradually, as he moves up, you will see him growing up into a very good individual. But the first few years of preparing him to school is very important, and that's where most of the parents are lacking, because here out here we generally tend to send the child to school only after 3. Till then he's generally left at home with the babysitter or with the grandparents, which I would strongly discourage parents to do it. Another important thing is that see to it that when you enroll him for a school or any nursery, for a simple nursery also, there are kids of his age and not kids lesser or maybe older than him, which wherein his growth, his mental growth will be hampered. So see to it that you visit the nursery or the school which you're planning to enroll your child, and see to it the age of the children before you enroll your child out there. That will help a lot for a child to grow mentally as well as physically.
Right. Thank you so much. Dr. Tanmay, you would like to add something on the same?
Yes, I think most of what Dr. Kedar said, I 100% agree with. I just like to add a few points here. Is that one is that I would advise all children to visit the pediatrician when the child is about a year of age, much before the child joins any playgroup or a nursery. And this is the reason for this is because the pediatrician will examine and look for the communicative skills and the intelligence of the child when the parents discuss these issues with the pediatrician. The reason is because it's important to pick up certain developmental disorders like a subtle case of autism or global delay or speech delay. These are things that need to be, or sometimes, certain kind of speech disorder, which need to be addressed well before the child goes to school so that the parents can be guided by the right person in that field. This is one thing. Second thing is that what I have seen or observed, and probably even Dr. Kedar must have also seen the same in his practice, is that many of the parents tend to delay toilet training in their children. And there are two issues here. One is prolonged bottle feeding, and second is delayed toilet training. And probably that is a fallout of the fact that most of the parents are happy to send their children directly at 3 years of age to the school, directly to the school. I completely agree with Dr. Kedar is that probably preschool training or some kind of, helping the children to learn how to socialize and mingle in a cosmopolitan atmosphere with children of other nationalities, even if it's just play and games, is healthy and useful to the child to sort of mentally and emotionally adjust themselves to join the main school at the age of 3 years of age. So I would also encourage them to, go to nurseries or daycare centers or play groups, whatever you may call them, just for a few hours for them to help to socialize and develop their emotional and social skills. And also, I would request all parents to start toilet training their children at least after the age of 1 year. Children are capable of understanding how to control themselves somewhere around 1 to 1.5 year of age. This is one thing. So, and second thing is that once the child learns to use a cup and a straw, or directly drink from the cup, or use maybe a sippy cup to drink fluids, bottle feeding is no longer required at all. And so, according to me, at least, bottle feeding is not required up to the age of 1 year. So, if the child can be rid of his or her bottle feeding and can be toilet trained, it's kind of and also can be screened to make sure that they don't have any speech delays or any autism or anything like that. This is one way of gearing up the child to enter a play group somewhere around the age of around 2 years or so that they can spend some time and socialize with other children. And this will then further help them to join their main school, and they'll become better adjusted children once they join the nursery or once they join the main school at the age of 3 years.
Well, thank you so very much for the detailed explanation, Dr. Tanmay and Dr. Kedar. So I'm sure our audience would have really taken a lot from both our experts, pediatrician specialists, who have given detailed information on all the questions that we have asked. Before we end up the session, I would like to tell you that Dr. Tanmay is specialist pediatrician at Prime Medical Center, Mota City. You can always book an appointment. You've got the number coming down in the slides at the bottom. You can always book an appointment through the application. And Dr. Kedar is currently practicing in Prime Medical Center, Burjuman. So you can also book an appointment for him in case if you want to see any of our specialists for today. Do give us a feedback. We will be definitely coming back with another webinar, which will be happening probably after 8 to 9 days. This is going to be more on back to school again with our more speakers coming in from Prime Healthcare. Thank you very much, everyone. Both the doctors, thank you so much for your time. It was wonderful. Probably a lot of appreciations are there from our audience that who were watching you at the moment during the session, and probably a good thing is that a lot of doctors have actually taken suggestions from you. So we really appreciate all that. Thank you very much. We'll be coming back to you with another webinar, as I said earlier. So till then, take care. Bye bye.